Hi, I'm Susan Taylor with Scripps Health in San Diego, California. According to the Centers for Disease Control and Prevention, there are nearly 40 million people in the US living with diabetes. And if you have diabetes, it's critical that you maintain healthy blood sugar levels. Continuous glucose monitors can track your blood sugar levels 24 hours a day. Here to talk about this is Dr. Athena Philis-Tsimikas. She's an endocrinologist with the Scripps Clinic Medical Group who specializes in diabetes and metabolism. Dr. Philis-Tsimikas is the corporate vice president of the Scripps Whittier Diabetes Institute in La Jolla, California. Doctor, thanks so much for being with us.
So happy to be here, Susan.
So in the past, how did people track their blood sugar levels? I mean, didn't they have to prick their fingers and get a blood sample?
You have to do it several times a day if you want to accurately try and distinguish what's happening before you eat a meal, after you eat a meal, at times of exercise when the blood sugars might dip down. So you're talking about potentially doing blood sugars 4 to 6 times a day if you want to keep good track of what's going on with your blood sugar levels.
So talk about the continuous glucose monitors, because these devices, you don't have to prick your finger, right? And do blood draws all day long.
That's absolutely right. And there's a number of these on the market now that are available, really 4. There are 2 that are easily placed, and I have a few just in front of me that I'm going to show you. They come with devices that are small. They look like this. They have the inserter on the inside. I'm going to show you one other one as well. They look like this. And the actual device that comes out and is placed on the skin looks like this. And
so on your arm,
place the device on your arm like this, you press it down, and the device is deployed. Is it okay if I show you what it looks like? Because I placed one on myself earlier just to show you, but this is what it looks like on my arm. I didn't feel it go in. It's not uncomfortable, and I can wear this in the shower, swimming, in the ocean, in a pool, and it doesn't come off. It detects and reads those blood sugars throughout this entire time period for 10 to 14 days continuously. So think about this, not having to stick your finger any longer for 10 to 14 days. What a benefit that is for our patients.
And you can wear these devices and nobody knows that you're wearing them, right? So you can go about your day at work and folks aren't going to know what your, your health issue is.
That's exactly right. The other nice thing is that these devices send the reading to your telephone. So it's looking just like you might be scrolling your telephone to see what's going on. And what it's really doing is reading your blood sugars.
And is that your actual blood sugar level right now?
That is what I'm running right now. So I am disclosing right now 93. You can see that there was I don't know if you can see, but there was a little bump earlier, and that was probably the lunch that I had, a few bananas and oranges and things. So in someone with diabetes, those blood sugar highs and lows may be much higher. In my readings, they're between what we consider the normal range, 70 to 180. But they can certainly go higher, and that's what the beauty of this is. If they go higher, then you can go and do something about it. Oh, maybe I have to take a little extra medication at this time, or maybe I need to go take a walk to try and bring those numbers down. High blood sugar levels can occur from a number of different things. They can occur from food. That's the most common. If you eat foods that are high in carbohydrates, and carbohydrates can come in the form of sweets and sugars, or they could come in the forms of starch like potatoes, rice, pasta, all of those things. If you eat them in a quantity that might be too much for your own body, can cause the blood sugars to go up. That doesn't mean you can't have them at all. And there are times when you can have them and your blood sugars go just up to where they should be and come back down again, especially if you're taking medications that might help address it, or might be exercising together with it. All these things can help moderate how high or low those blood sugars go. If it's related to stress, maybe I need to think about calming situations and other methods that we have to calm down and try and bring some of those stress levels and blood sugar levels down.
And some of these devices now are available without a prescription.
That's right. If for some reason they have health plans that don't cover these, they can get them over the counter and can put these on themselves and watch to see what's the effect of all the things that we just spoke about.
Now, obviously, if you have, diabetes, this is very good for you. But what if somebody doesn't have diabetes? What would be the reason for them to put on one of these blood glucose monitors?
Maybe one of the most interesting things about the statistics of diabetes in our country is, you mentioned nearly 40 million people that have it, but about a quarter of those people don't know they have it. Yeah. So, just think, you might not think you have diabetes. Maybe you have a family history. Maybe you fall into a category that puts you at higher risk. You could place one of these now and see what happens, and potentially detect much earlier if you're either at risk for diabetes or have diabetes. And that can be very valuable, because if we can catch this earlier, we can treat earlier, provide resources to you in order to allow you to best manage the disease.
And do these devices work for both type 1 and type 2 diabetes?
They absolutely work for both. Very interesting, because in both conditions, type 1 and type 2 diabetes, your blood sugars are going up and down. You're taking medications, you're doing other things that can influence your blood sugar. So very valuable in both conditions, absolutely. But they have one added benefit in type 1 diabetes, which is they can connect to an insulin pump. An insulin pump automatically delivers insulin into the body through the skin in a continuous basis as well. Previously, that amount of insulin had to be manipulated and maneuvered by the patient themselves. Whereas when we can connect this now with this device, the CGM device can give the blood sugar to the pump, and the pump now has algorithms embedded in it that can begin to predict how much insulin they should be giving someone, or can see the rise and go ahead and react and give them a little bit more insulin at that time. And it allows the patient to much more tightly control those blood sugar values, which is really nice. They don't have to think about it as often as they used to. That helps lift some of that burden that someone might have about it. I have just a couple devices I'll show you, just to show you what they look like. These are just a few. There are some sort of hardwired ones, but we also have wireless, like pod ones, that can stick similarly. So you would have to wear the reader on one side that detects the continuous glucose monitor. You'd have to have the insulin delivery device on the other side. But just think how convenient now that becomes. Not only convenient, but it's actually better management for the patient as well.
So talk about the benefits of using a continuous glucose monitor.
I think there's a number of benefits. Knowledge is probably one of the biggest ones, right? It's beginning to tell you when your blood sugars are going up, what's affecting those. Is it what you're doing at the moment? Is it the medication that you're taking? You might need to adjust that. You might need to have that discussion with your provider. If you're dropping down, do you need to make some changes there as well? What happens if you're dropping down overnight and might not previously detect it? One of the big benefits is that you get notifications now at times when you previously might have slept right through things, even at dangerous time periods. Think about if maybe you're driving and the blood sugar begins to drop, and it can give you a warning ahead of time. So those are all huge benefits of wearing a device like this.
So once you get a handle on the blood sugar levels, there's really tremendous health benefits to that.
Tremendous health benefits, no doubt about that. Health benefits overall. It's not just to the patient. Just think the people around them, their family members, and what it means to them to have their loved one understand what's going on, be able to be aware, and to address it in the best way possible for them as well.
And to help improve your quality of life.
Absolutely. You got it right on.
Any final thoughts, Doctor?
No, thank you for giving me the opportunity to talk about this amazing new technology. I think it's only going to continue to contribute to the benefit of how we manage and take care of our patients and what we can offer them. And I'm looking forward to everything else that's going to come in the future related to these devices.
Technology is amazing. Doctor, thank you so much for being with us. We appreciate you taking the time.
Thank you, Susan.
If you want more information on continuous glucose monitors and to see if in fact they are right for you, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.